Welcome to the Alfred Hospital Intensive Care Unit. We know that this is a difficult time and visiting patients here can be stressful. We hope that this video and the iPad app which follows helps you to understand some of the things you'll see whilst visiting the ICU. The Alfred ICU is a highly specialised ward that looks after patients with life-threatening or potentially life-threatening conditions. It is staffed 24 hours a day by highly trained medical and nursing specialists. The unit is divided up into 3 sections, or pods. Beds 1 to 15 are within the cardiac pod, 16 to 30 the trauma pod, and 31 to 45 the general pod. It can be confusing to find your way around, so please don't hesitate to ask any of the staff for help. Each pod has staff work areas running down the middle and patient cubicles running along either side. Some cubicles have a curtain for privacy, whilst others have sliding doors. When you enter the cubicle of your loved one, you might notice several pieces of equipment in the room, such as a monitor displaying numbers on the screen, pumps which deliver medication, and ventilators which are used to help some patients with their breathing. Your loved one might be sedated with medication to help us deliver their treatment. The ICU can be a noisy place with lots of people and alarms. However, most alarms do not signal an emergency.
Each time you enter and leave the unit and cubicle, remember to always wash your hands thoroughly with the hand gel provided.
This will dry automatically. You'll find this in every cubicle and at the front door. We use this to stop the spread of infection. We strive to communicate well with patients and their families, as this is a very important part of the healing process. The doctors will routinely meet with the family of a patient very early in a patient's stay. This gives you the opportunity to understand why your loved one is unwell, and for the doctors to answer any questions you might have. During this initial meeting, you will be asked to sign a consent form. It's helpful if you take the opportunity to read the consent form, as well as the procedures and therapies section of this app before you first meet with the doctors to see if you have any questions you might want to ask during the meeting. If you would like more time with the doctors, please let the bedside nurse know so we can schedule another meeting. We've designed this app for patients and families. We hope that it will help you understand our ICU and staff and explain some of the therapies that are used here. We hope that it makes your experience in ICU less confronting. We really value and encourage your feedback and would appreciate you spending a couple of minutes to complete a survey. You can find this on the menu page of this app. Here at the Alfred ICU, we focus on helping patients and their family through this difficult time. Our aim is to provide the best care and to achieve the very best outcome possible. If you have any questions or require any further information, please ask at reception, or you can ask any of the ICU nursing or medical staff.